Hi, I'm Cathy Wolfe, and I'm President and CEO of Global Growth Markets for Wolters Kluwer. I want to start by saying I'm really impressed with how much the government is doing to increase access and the quality of healthcare. In terms of education, there are a lot of new seats being added at both the undergraduate and postgraduate level. There are colleges being expanded. There are new colleges opening around the country. And I think that is really terrific for advancing the quality of healthcare and access of healthcare for Indian citizens. Healthcare education generally is really challenging because there is so much new research and evidence coming out all the time that the doctor needs to keep up with. And often patients have more and more things going on, diseases like diabetes or cardiovascular diseases are increasing in the world. And so doctors just have an increasingly complex job of keeping up with them all. So you take that back to education, and it's really important that you start with educating the doctor how to use evidence to treat patients and how to keep up with new evidence. And this is quite complicated because nobody walks in with just one thing wrong. Usually they have some history, they might have some other interaction going on. Men may present differently than women. There may be something new or rare going on. So really teaching doctors how to access the evidence, but also how to be curious, how to ask questions, how to think about what might this be, especially if it's something that's not a mainstream common thing, is really important. So, in terms of medical education, in India, the schools are turning out more and more people. They're starting to consider digital, but I think there is so much more opportunity for teaching doctors how to think, how to evaluate evidence, even encouraging more research among students and doctors in the country. All of these things are going to lead to the two main outcomes or desires of health. One is better quality outcomes, of course, for the patient, but the other is equitable care. You want every patient to have the advantage of having high quality healthcare, no matter who their doctor is, by having them all have access to this evidence and really have this kind of training to be thinking that way. Really, the best way for doctors to be able to keep up with new evidence and diagnose and treat patients more quickly, accurately, and confidently so they can drive these better outcomes is to use a product concept called clinical decision support. This actually is a concept that is only about 30 years old. And what it does is it involves looking at all of the evidence, all of the research for a particular condition or medical specialty, and having doctors look at it, bring it together, and write it up and present it in a way that is oriented toward how the doctor thinks, what questions they're likely to have, what confusion there might be, maybe with a possible other diagnosis, and put it in a standard format. So even in a critical life and death, I have to make a decision in the next few minutes or hour situation, they can actually find the information they need. So what does a good clinical decision support product look like? It has great content about the latest evidence. It is updated as new evidence comes out. It is oriented toward how the doctor behaves or needs to think in a critical situation. Technology helps with ease of access, but it actually plays a bit of a supporting role. We all love to get excited about technology, including me, and it does more and more for us. But if that content isn't there, then you're really not going to get the right answer, even with the best technology. One fact that most people don't know about doctors, and that has come out of third-party research that's been done, is that the average doctor actually has 15 to 20 unanswered questions about patient care every single day. And what this research showed was when they had access to a clinical decision support system, they were able to answer not just those questions, but to change their decision 40% of the time to be able to provide better quality care. On the other hand, without clinical decision support, 60% of those questions didn't even get answered. So it just makes such a dramatic difference in the doctor's ability to treat the patient. Wolters Kluwer has a product called UpToDate, which actually created the clinical decision support category about 30 years ago. A very visionary doctor saw the problem of doctors being able to diagnose quickly, accurately, and confidently, and created this concept. And it was a huge amount of work to develop the right process for putting together the content and the right format to really, help the doctor in that moment of need. So he started with one specialty. We now have well over 20. And it has become the essential tool for 2 million doctors around the world and growing, significantly every year. Here in India, we have about 200 customers. That's actually double than what we had about 18 months ago. About 40,000 individual users. We also work with pharma companies who sponsor doctor education. And I would say to know this product is to really love and value it because it is so thorough. It's written by doctors and it is peer reviewed to make sure it's incredibly accurate. We have over 6,000 external experts, the top, doctors in every specialty contributing to this. Wolters Kluwer is so excited to be in India and be part of the healthcare journey here, which is just moving along so quickly, especially in the last couple of years. We've actually been in India a couple of decades. We provide medical books for undergraduate and postgraduate medical students. We have journals that are used in all of the top institutions around the country. And of course, we have our clinical decision support system that we provide. I have 3 very specific recommendations for hospitals, for medical schools, and for healthcare policy makers. The first thing is within medical schools, clinical decision support should be in every library and be used in the curriculum. If you want to create quality outcomes and more doctor efficiency, of course, you start with the right kinds of habits at the educational level and the right kind of student engagement. Second is once doctors are into practice, every hospital should have access to a clinical decision support system. It really shows a commitment to quality care. And there are literally more than 100 studies on our UpToDate product that show all of the benefits that it delivers. The third thing is medical practice changes all the time. There's always new evidence. Doctors need to keep up with it. I'm really excited to see that the National Medical Council is talking about requiring continuing medical education hours for doctors. That's really fantastic. The most efficient and effective way for doctors to learn is through the use of clinical decision support. As they treat patients, they're learning things all the time and they're building on that knowledge all the time. And so it's both teaching them and driving better patient outcomes at the same time. So if you're out there listening, policymakers, I hope you will take this to heart. And also, if you're a hospital, please buy a clinical decision support system. It's just absolutely life-changing for your patients and for your doctors.